Welcome to Capital Update. I'm your host, Matt Swenson. This is State Representative Bev Scalze. Welcome, Bev.
It's great to be here, isn't it? I mean, spring is bursting out all over, and it's such an exciting time at the Capitol. There's so much going on.
Lots happening here at the Capitol, lots to talk about on today's program. And I know the biggest thing you folks are focusing on right now is the $994 million budget deficit the state is facing. And I know that you folks have already taken quick action to resolve 1/3 of that budget deficit.
Absolutely. All of the departments, with the exception of K-12 education and health and human services, those two are the largest parts of our budget. But every other part of the budget has been addressed and the cuts have been made, and there's been some quite drastic cuts. I know in our environment and natural resources budget, in some areas we cut 6.5%. So there will be, we're predicting there will be some layoffs in PCA, DNR, Board of Water and Soil Resources. So it's not a good time, and we just had a huge deficit. Now we've got this $1 billion deficit, and then we're looking at another $6 to $7 billion deficit in the next biennium. So it's not a good time. And this has been going on for quite some time now because of the economic downturn that began in 2006. And we don't see anything good happening in the near future.
So some very difficult decisions that need to be made here this session, but I know that you're setting some real priorities for the state. In particular, I know that at the same time that you cut funding for a number of programs, you actually increase funding for veterans when it's most needed right now.
Yes, and we have a lot of returning veterans, and people don't understand how that impacts other parts of the budget as well, because a returning veteran needs a job, and we have no jobs. We have more job seekers than we have jobs. So it's very difficult for those returning veterans, and a lot of them we found have been on general assistance medical care. And so we're trying to figure out how to get those veterans onto veterans programs that may be better for them than the general assistance medical care. It's a very tough issue, and we're going to see this continue for quite some time. So we have to continue to work on this and make it the best for our returning veterans.
And you mentioned that the health care budget as well as the K-12 education budget have yet to be resolved, and that's because there's still some information we're waiting on from the federal government. An expected $408 million is supposed to be coming to Minnesota in the coming weeks in a federal jobs bill.
Absolutely, and Minnesota is one of 11 states that would get this funding. It's an amazing part of the, and I'm hoping I get this right, Patient Protection and Affordable Care Act. That's the federal Health Care Act. But in the money would come, but we have to match it, and we have to continue the programs at the same level. We can't cut a program and then get the money. So we don't have the money to match it, and we're thinking of using the Healthcare Access Fund. But we're thinking that may not come before we adjourn on May 17th, because only the Senate has passed it. So it has to come from Washington, and it has to be here before May 17th so that we can match it. So the problem is we don't have any reserves left, and this is a time when you'd like to have a reserve so that you can match federal funding. Now, the Medicaid funding in 2014 would be 100% funded by the federal government. Unfortunately, we have to get through the years between now and 2014, and that's when we need the matching funds.
Well, definitely some very difficult decisions that need to be made here, particularly considering that last session $1.3 billion was cut from health and human services programs. This is funding for the disabled, the poor in our communities, the elderly, nursing homes, hospitals. These are some very difficult decisions.
They are difficult, and it's the long-term care with the developmentally disabled and seniors in nursing homes. That's really the largest part of the health and human services budget. And we did cut the developmentally disabled budget last year 2.58%, and that's quite a severe cut. Those jobs pay anywhere from $8 to $11 an hour for the people who work on our most severely disabled or our seniors. And they work very hard, and we really appreciate the service that they provide to the community. But that was tough. They had to get that cut, and we may be looking at another cut this year.
Well, very tough decisions. I know that you'll continue coming back and letting us know what's happening here in the weeks ahead.
Absolutely, and there's lots happening, so there's going to be a lot to talk about.
Well, great. Thank you so much, Representative. We'll see you next time on Capital Update.
Thank you.